Professor, what are the guidelines about the intake of salts and hypertension?
Yes, the World Health Organization guidelines, which are globally implemented at the moment, are for a moderate reduction in salt consumption up to 5 grams of salt per day, which has been proven to reduce not only hypertension, but mainly cardiovascular disease, so heart attacks, strokes, and renal events. And that is now being implemented not only in the developed countries like Europe, United States, and Australia, but also in low and middle income countries.
There is a debate about the extreme low salt intake. What is your opinion?
Yes, and more recently there have been some indications to suggest that if we reduce salt too much, there might be some risk in a group of people to have an increased risk, particularly of heart failure. Now, these indications are based on studies which were flawed for many reasons. Methodological reasons like assessment of salt intake was flawed by using the wrong methods. The use of some cohort studies, prospective studies, were affected by what we call reverse causality. There were very ill people taking into account, were increasing the risk. When the studies have been carried out properly, and there are a couple of American long-term studies and some small intervention trials, the studies have shown that there's no risk whatsoever at the level that we suggest should be achieved, which is around the level of 5 grams of salt per day.
And is there differences between young people and old people?
Right. In general, salt works in everyone, in men and women, at any age, in any ethnic group, in any country. However, due to the physiology of the response, the size of the response may vary and gets bigger as we get older. So in principle, older people tend to benefit more from a reduction of salt intake, as well as they tend to risk more if they eat more salt.